Welcome to the fourth session of the third series of the PPCL ECHO program. I'm Dr. Olivier, and I'm going to be the coordinator and the facilitator for today's meeting. So we're going to go over a few housekeeping items before we begin. Some of y'all have already done this, but please enter your name, title, organization, and email address in the chat. That's for attendance purposes. Go ahead and advance the slides, Jen. We'll take a look at the agenda for today.
Sorry, y'all give me just a minute.
It's okay.
Technical difficultying.
There we go. There we go. So in a few minutes, I'll do introductions to your hub team, and then we're going to go into our didactic presentation. Unfortunately, Jody was going to present today, but Jen Bordelon has graciously stepped in to help present on grief in children and adolescents. And then we'll go right into our case presentation by Dr. Flake, and then we'll open the floor for clarifying questions and recommendations, and then have a 5-minute wrap up. Next slide. So again, I'm Dr. Olivier. I'm a child and adolescent psychiatrist out of Lafayette, Louisiana. I have a private practice here called Bloom Mental Wellness. And I'm going to go through and ask the other hub team members to introduce themselves, starting with Dr. Queen.
All right, I'm Dr. Katie Queen, and I'm a general pediatrician, also practice obesity medicine, and I work for Our Lady of the Lake Children's Health, and I'm part of the ECHO hub team for the second cohort and the third, I guess. I mean, second time.
Thanks, Dr. Queen. How about Ashley Hutchins?
Hi, my name is Ashley Hutchins. I'm a psychiatric nurse practitioner. I work at Bloom Mental Wellness in Lafayette, Louisiana.
Thank you, Ashley. Jen, you want to go ahead and introduce yourself too?
Sure. My name is Jen Bordelon. I am an LAC, LCSW, and I work as the resource specialist for PPCL, but today I'll be doing the didactic presentation.
Awesome, thank you. And Sienna, you want to introduce yourself too?
Hi, my name is Sienna Nakos Caldwell. I'm a licensed clinical social worker, and I'm one of the consultants on the PPCL team.
Awesome. Thank you all. And thank you, everybody. And also on our team is Lena Raggett. She's also a licensed clinical social worker, and she's out on maternity leave too. So I appreciate y'all being here today. We have a good mix, it looks like, of psychology, social work, therapists, doctors. So welcome. Next slide is just a reminder about the PPCL provider-to-provider consultation line. Just a reminder, any of you can register for this and call in if you have a case you need a consultation with. Our providers will hook you up directly and consult directly with a psychiatrist, because we know behavioral health resources are very limited in the state of Louisiana. So just a reminder to call with your cases and get some consultation on those. All right, we're going to roll straight into our didactic presentation with Jen Bordelon. So go ahead and take it away.
All right. Good afternoon, everybody. We'll get started with didactics. Today, we're going to talk a little bit about grief responses and what grief responses look like specifically in children and in adolescents, and have a little bit of a conversation about what we need to sort of keep our eyes out for. So first, we like to start by kind of defining a couple of key terms. One is grief, and we've all sort of heard the term used and have a general sense or understanding of what it is. But for today's purposes and understanding, I want to specifically talk about grief as being an experience and emotional response to a loss, and that can be a loss of any kind. So this is particularly important in young children. There may be a loss that does not involve a death or death of a loved one or family member, but is still significant to that child. So for those purposes, we want to keep a kind of an open mind about what this grief process might be initiated by. It doesn't always start with a death. Then we also have bereavement. So bereavement is specifically an individual's grief response that is related to death. And so you will see those two things come up in the literature. And I just want to make sure that we are all kind of on the same page, that grief that process can be started by things other than death. Loss of perception of self, loss of a status or role. Let's say I was up for captain of the cheerleading squad and I don't make it, right? That loss of status, I may have a grief response to that as an adolescent. A child that loses their favorite stuffy may have a grief response to a lost stuffed animal. And to adults, that may not seem logical that a grief response could be initiated over something quote unquote so small. But for kids, really, it makes a lot of sense to think about grief more broadly because they will have reactions, grief responses to things that are not death. And so we need to keep an eye out for that. Nextly, I wanted to talk a little bit about there are two things that we can hold as universally true about grief and the grief process. The first is that it's incredibly complex and it's nonlinear. So it's not a start point and an end point with very clear steps that we go through, like following a treatment plan, and we get down there and we've completed it, we've achieved our goal. It's very rarely that grief presents as a straightforward, point A to point B process. There can be a lot of progress that's made, and then there can be some regression. There may be times that the grief seems to take sort of a back seat and it doesn't seem very prominent, and then it kind of pops up and it's the overwhelming forerunner as far as what you're working on with that patient or that client. So understanding that we don't set time limits on grief for diagnostic purposes, the time that somebody has been experiencing symptomology will let us do a good differential to get a diagnosis if there is some complicated grief. But truly, there really isn't a time limit on how long this process can take. And so keeping that in mind and being open-minded about how we approach this really allows us to sort of keep our ear to the ground and our finger to the pulse of what kids may be going through, but not able to verbally express yet. So then expressions of grief is that second piece. And they're infinitely varied. As many individuals as there are on the planet, there are that many different responses to grief. And so it will look different from person to person that you see. And there's not really a catch-all that, if we can tick these 5 boxes, then that person is experiencing grief for sure. It's gonna look different depending on who you're working with, what grief they're going through, what type of loss it is, and sort of where they're at in the process, how much practice they've had with loss and going through the grieving process. When we are looking at expressions of grief in really young kids, so kids that are under 5, the things that we want to pay attention for and sort of take mental note of are if they seem to be really affected by emotions of the adults around them. So really young kids may not have sort of their own individuated grief process. They're still very attached to the parent figure or to that caretaker. So they may model or mimic that caretaker's grief response. And you will see oftentimes that kids may not even seem to have sort of the saddened or depressed affect that comes with grief. They may just have some strange kind of behaviors that we pick up on. So that could be them being more kind of fussy, irritable, a little more clingy, being more attached to a parent or safety figure, being really matter of fact about death and dying and sort of asking very black and white questions because their understanding of death is very different when they're under 5 versus when we get to dealing with sort of like older children and adolescents where they have a concept of what death means. Changes in appetite, behavioral changes, difficulty concentrating and making choices, nightmares, and even regression to earlier behaviors. So if you're looking at a 5-year-old who hasn't had bedwetting problems, and since toddlerhood and starts bedwetting again, that may be indicative of a grief response. In older kids, so over 5, but not quite adolescent yet, you'll see grieving in doses oftentimes. And grieving in doses is just what it sounds like. There can be waves of grief, and then things they appear from outside perspective to be normal. And that kid is functioning and playing and sort of, encapsulated in their own world. And then every now and again, the grief will come back up and be kind of a priority. And so you'll see that happens pretty consistently in children, and it can be hard to kind of tease out, like, is this a grief response? They seem okay most of the time, but then there are times that they seem, there's some things going on emotionally. Again, we're looking for changes in behavior, changes in appetite, sleep disturbances, wanting to be in bed with an adult at night, that clinginess, that needing for extra reassurance or a sense of safety. And again, looking for that return to previous behaviors, a regression to earlier childhood behaviors, thumb sucking, bedwetting, things like that. Expressions in adolescence look a little bit different because they are starting to have a much better idea of what death actually means. They understand the finality of it, are starting to be able to grapple with some of the emotional fallout from that. So there is going to be potentially an experience of shock or disbelief, where there's that denial that we see as a kind of standard grief response, that this isn't happening or this can't be. There can often be trouble in school performance because the concentration ability is just not there. There's some fogginess and sort of inability to focus on what's in front of them. There may sort of be this emotional numbing where we see very little emotional reactivity, where you would expect to see more, and that can kind of look like isolation or withdrawal. And something that I think we don't think about is that bullet in the middle, the non-compliance to requests. Adolescents can really get to that point in the grief response where they feel very, very conflicted with the world around them. And so they become somewhat defiant in certain instances and don't want to do what they're being asked to do, whether that's by a parental figure or an authority figure at school or a coach. But paying attention for that as well, the sort of acting out behaviors that may not have been present before. Certainly any major personality changes. If you had an adolescent that was, sunny and outgoing, and all of a sudden just does not want to hang out with friends, isn't taking calls, stays in their room, those would be like big personality changes we'd be worried about. Also, risk-taking behavior. Adolescents are already kind of prone to be taking some risks in that developmental stage of their life, but especially a deviation from sort of their normal risk-taking behavior for that kid. And that could include sexual risks, that could include drugs or alcohol use, or anything that is sort of like adrenaline-inducing. It is also important to pay attention to, because that can often be the adolescent's way of initially reacting to and responding to a loss. Let's see. Oh, and I wanted to draw attention to a need for checking in on parents and siblings often comes up in these grief responses. The adolescent has more of ability to feel that sense of responsibility. And so you may see that as them sort of taking on this role of caretaker or somebody that needs to check in and make sure everybody's okay, which can in turn manifest some anxiety related to that. So what you can kind of expect, and I'm not going to read through each of these, I know this is a pretty wordy slide. What you can expect is sort of this stuff here on the left, that the kids, regardless of age, may sort of push you away or pull you back in a clingy way. They may do both. You may see sort of this vacillation between wanting you close and not wanting anything to do with you. They're really on their own journey. It's not going to look probably like your grief journey if you're also going through grief. So if the parent or caretaker is experiencing the grief process at the same time that the child is experiencing the grief process, that's going to affect the dyad, right? That's going to affect how they respond as well. And the intensity is going to depend on child and the type of loss, right? Whether it was a loss of a sibling, a caregiver, whether it was a traumatic and sudden loss or a prolonged sort of more expected death, can make a difference in what the presentation looks like. And out of all of these things here, for what you can do over in the right-hand column, really truly being available, being present for that child to approach you when they are ready to have a conversation, and trying not to, I think, do what some parents and caretakers may try to sort of put on that stoic front, so that they don't inadvertently upset their children. They may think that they have to sort of not let their kid in on their grief experience, that might be damaging to them. And really, the literature tells us that the opposite is more true, that kids need to have that connectivity more than anything during that loss period. And your withdrawal of emotion in an effort to protect that kid will oftentimes leave them without that connectivity that they require to start the healing process. And so you're going to want to think about complicated grief disorder in infancy and early childhood. If this grief process goes on longer than 30 days, we can do some assessment and try and diagnose if this loss seems to have triggered something more complicated, more complex than kind of the average grief response. The other thing, and I know I'm coming close on time here, or I'm a little bit over, right? I'm okay. All right.
You're good. You have 7 more minutes.
Oh, nice. Okay. Then the other thing you want to pay attention to for like clinically significant grief, this is when we start talking like diagnostically, like what am I considering? So potentially complicated grief, right, in kids under 5, the DC 0 to 5. But then take a look at this list. It is pretty comprehensive. I won't say that it's like everything that could possibly be a red flag, but it covers a lot of the more common red flags that if your child, or if you are encountering a child that is experiencing any one of these, you really kind of want to perk those ears up and sort of pay more attention and maybe do a little bit more probing about the extent of this grief for the kid, because these symptoms kind of indicate that there may be a more pronounced grief response. Again, there's inappropriate sexual behavior, drug and alcohol use, attention-seeking behaviors, prolonged withdrawal. Really significant changes in school performance are a pretty good tell. Not showing up for school, like stopping participation in things like school or social activities. And recurrent thoughts of death. And that doesn't always mean suicidal ideation, but it means that they may have a fixation on the topic of death as part of their processing of what bereavement is to them. And then there could also be that complicated piece where there are suicidal thoughts and some suicidal ideation, or even some self-harming behavior that has been started. And that would be something that we would want to definitely treat sooner rather than later. And so this is not something that you sort of like wait and see, like some of the other symptoms of grief. These are the ones that we would really want to follow up and maybe talk to your provider, your psychiatrist or a therapist about what interventions might be appropriate at that point. So in the DSM-5, there's a proposal for like persistent complex bereavement. And for adults, that's like 12 months or more. And for kids, that's 6 months. And I think that that's really important to pay attention to the timeline, because a lot of folks worry about kids' grief process if it goes on longer than a couple of weeks. And I don't think that all the time adults realize how long this can go on for kids and really not be problematic in a clinically diagnosable way. And so there's nothing quote unquote wrong if a particular child takes 4, 5, 6 months to go through that grief process and that grief cycle. The really important thing for the adult, the caretaker, to know is that if any of the symptoms are persisting, that they shouldn't be ignored. So if they do go on past that 6-month period, or if there are any of those red flags like suicidal ideation or self-harm, we don't have to wait 6 months to know that that's not going to be something that resolves on its own and that that's something that needs more immediate intervention. I wanted to talk a little bit about differential diagnosis considerations because I think that grief oftentimes brings up symptomology that we see in so many of these other DSM categories. And so looking at the different categories, you've got sort of different symptomology underneath each that may indicate like where that crossover lies for symptoms. So for trauma and stress-related disorders, you're going to want to consider, so like, is this grief? Is this trauma? And it could be that there is like maybe a flavor of both. There may have been a traumatic experience that resulted in a loss. And so there may be grief, but also trauma happening at the same time. So we want to be really clear about what we're observing symptom-wise and tracking that to its antecedent, timeline-wise. And when you're looking at those trauma and stress-related disorders, so the fixations on death or bedwetting, thumb sucking, nightmares, sleep disturbances, could point to a trauma or stress-related disorder. When you're seeing in grief sometimes anger, irritability, and outbursts, often you'll see that both in young children and in adolescents, honestly. When you see those anger outbursts, that aggressiveness or defiance, some of that risk-taking behavior, it may sort of have a flavor that feels like a conduct disorder, that feels like maybe ODD. So it's important to do a thorough history and make sure if you are sitting across from a kiddo that seems like this might be ODD, maybe ask a question or two about if there's been any recent loss, because it could very well be a grief response rather than a conduct disorder. Additionally, we've got mood and anxiety disorders. So those symptoms cross over a lot of different diagnoses. And I think those are maybe some of the more common ones to be co-occurring. So there may be grief that then ultimately turns into, say, depression. And I may have a depression diagnosis that I'm dealing with in addition to the grief or loss that initiated that symptomology. Remember, we talked about the compulsive check-ins, especially with adolescents, wanting to check in on siblings, check in on mom or dad to make sure that they're okay multiple times a day, checking in, taking on that responsibility or that role of caretaker. That can oftentimes look like some compulsory anxiety disorders or OCD, or even like separation anxiety if it's in younger kids. So teasing that out and asking questions about whether there's been a recent loss can really help you put your finger on what portion of the DSM we're kind of looking for a diagnosis in. Developmental disorders, that emotional dysregulation, that difficulty regulating emotion, sort of social isolation or regression can look a lot like sometimes ASD or other developmental delays. And I think that, again, finding out and just asking a quick question about whether there's been any recent loss, not death, but any recent loss that might be significant for this kiddo. And sometimes the way that I'll phrase that is any recent loss or change that they might be having a hard time dealing with. Then we have substance use disorders. That's not going to apply to your very young kids most often. I won't say that it's never happened, but usually adolescents, when we start worrying about substance use disorders and trying to tease out whether their engagement in drug and alcohol use has more to do with a substance use disorder versus if it is a coping mechanism that they're sort of seeking out because of a grief response. Now, obviously, if they end up with a substance use disorder that started because of grief, I'm treating both, right? I'm not just treating one or the other. They can co-occur. So paying attention to how many of those symptoms cross over, I think, is really important. There are a lot of other things that grief can kind of look like and camouflage itself as, and to to write somebody a diagnosis without considering grief first really, I think, does a disservice to going through that full due diligence. These last pieces here are resources that you all will be able to, when you get the PowerPoint, click through. It gives Healing House is a great resource here in Lafayette for kids that have lost a caregiver or a sibling. These links underneath for kids and for adolescents or teens are book list recommendations, and they actually are really solid. There are about 15, 20 books at different reading levels, and to help process and inform and educate kids about that grief process. There are books for the kids, and there are also sort of like the parent piece that goes with it. The Kids Health website has a lot of resources. Sesame Street has a whole section of their website dedicated to grief and the grief process. If you are sort of stumped or none of these feel like they fit for the family you're working with or for the kiddo you're working with, think about books or episodes of TV shows and characters that they really like, and just do a quick Google search for Bluey and grief, and it'll show you the Bluey grief episode, right? That then can start that conversation with your kid, because the name of the game is to make sure that we're identifying these symptoms of grief, but also then acknowledging them, right? Have that conversation. We're not going to sweep it under the rug, and we're not going to pretend like we're not sad or having an emotional reaction ourselves. And that's part of, the being present for the kids. Here's some references, and that's it. We're open for questions if you have any.
And everybody will get a copy of the PowerPoint emailed to them after this presentation. Thank you, Jen. We're going to hold questions for now because we're going to go right into our case presentation just for time's sake and to stay on target from today. But thank y'all so much for your participation. Thank you, Jen, for the didactic presentation, and thank you, Dr. Flake, for the case presentation. I really appreciate it, and great job.
Yeah, and it was wonderful seeing all of you all here. If y'all have cases, don't be shy. You know where we stay.
Absolutely.